Dr. De La Cruz, if you wouldn't mind, if you could fill us in a little bit about your background and how you went from a large medical center and a very conventional practice to a more integrative therapy and philosophy.
Well, yeah, I started out like all the other residents, doing the tests and trying to help people get better. And as I mentioned, a lot of this I outlined real nicely in the introduction to my book, like how I got there. But the idea was that I found that for a lot of illnesses I couldn't cure. I thought being American trained I would be able to cure 90% of what came to my office. But I found that sure I could cure pharyngitis and bladder infection, a lot of simple types of infections, but the common stuff like migraines, back pains, irritable bowel, joint pains, I really had no cure. I only had medications that I was sometimes afraid to give them because I knew they had side effects. So that led me to start looking for ways to help patients, and then I started learning about this whole area of mind-body medicine, and that got me into thinking more about how patients, if you could teach them to meditate or handle their stress better, and there was enough research supporting that. A lot of stuff going on at Harvard with stress management, the work of Herbert Benson. So after that, I was using and helping a lot of patients. I remember patients would come up, oh, I'm so grateful, first time I'm sleeping without sleep medication in years, just by helping them manage their stress. But then over time I found that if I help them change their nutrition, or if I brought in certain supplements, I could help them even more. So now I'm doing mind-body medicine plus nutritional medicine, and then later I started to learn more about hormone imbalance and how they can throw everything off, and how stress especially, and our poor diets can be another stressor that causes more imbalance in our hormones, besides what has to be the inevitable imbalance just due to aging. So now I'm looking at hormone balancing, and that brought me to the whole idea of restorative medicine. So now I can't help but put it all together. And right around that time was when I finished my book, Balancing Act, which is again about a mind-body-spirit approach to optimal health. There's nothing in there about writing prescriptions. It's all about, again, self-health skills, things that my patients can do, things that have to do with how you sleep, how to get better sleep, for example, choose a better diet, managing stress. But managing stress is managing life. So ultimately, you manage your life better, everybody wins. You feel better, those in relationship with you feel better, at work you're going to feel better, and your fellow employees appreciate you, enjoy you more. It's all connected. So all these great ideas that I've always had about life just come together in an integrative approach to medical care.